Welcome to Timeless Wisdom for Seniors, the place where we celebrate a life well lived and the joy of making every year count. Have you ever stopped to think about what you'd actually do if a heart attack hit right here, right now, and no one else was around to help you? It's one of those terrifying what-if moments that most people try to push out of their minds. But the reality is, for millions of older adults, this scenario isn't just possible, it's likely. Many people live alone by choice or by circumstance. Some spend most of their days in solitude, whether due to retirement, the loss of a spouse, or simply enjoying a quieter lifestyle. And while independence can be a beautiful thing, it also comes with certain risks we don't always talk about. And one of the most urgent is what happens when a medical emergency strikes and you're the only one there to respond. A heart attack doesn't always come with a loud warning or dramatic scene. Often it starts with a whisper, a strange tightness, a wave of nausea, feeling you just can't quite shake. And in that moment, what you do or don't do can determine the outcome. The first few minutes are critical. Every second matters. But here's the good news. Even if you're completely alone, you are not helpless. You don't need a medical degree or a house full of equipment to increase your odds of survival. What you need is a plan. A clear, calm understanding of what steps to take the moment your body tells you something is wrong. This guide is here to help. We'll walk you through 7 life-saving actions you can take if a heart attack begins and you're the only one there. These steps are straightforward, practical, and based on sound medical advice. They won't just give you hope, they'll give you tools. Whether you're watching this for yourself, a loved one, or simply out of curiosity, what you learn here could one day save a life. So take a deep breath, settle in, and let's walk through what to do, step by step, if you ever find yourself alone during one of life's scariest moments. When most people imagine a heart attack, they picture a dramatic, movie-like scene, someone clutching their chest, gasping for air, and collapsing to the floor. While that image may reflect some reality, it's not the full picture, and it's often misleading. In real life, heart attacks rarely begin with that kind of obvious drama. In fact, the early signs are usually far more subtle. They often arrive quietly, so quietly, in fact, that many people ignore them altogether until it's too late. You might feel a pressure in the center of your chest. Not necessarily pain, but a sensation, like someone is pressing down on your chest with a heavy book, or like a tight band is slowly wrapping itself around you. It might feel like heartburn or indigestion, making it easy to brush off. The sensation can come and go, which tricks people into thinking it's not serious, but that's just the beginning. Heart attacks often bring a variety of other symptoms which may seem unrelated at first glance. Shortness of breath, even if you're sitting down and not exerting yourself. Fatigue that feels extreme and sudden, like you've just run a mile even though you haven't moved. Discomfort or pain that radiates into the arms, shoulders, neck, jaw, or upper back, especially on the left side. Dizziness, nausea, or a cold sweat that appears out of nowhere. Feeling off or unusually anxious as though something isn't quite right, even if you can't explain why. These symptoms can show up in ways that are particularly confusing for older adults or women. Instead of sharp pain, it might feel like bloating, back discomfort, or a strange pressure under the breastbone. That's why heart attacks in women are sometimes misdiagnosed or go unnoticed until the damage is severe. Let's look at a real-world example. Judith, age 71, was folding laundry one afternoon when she noticed a dull ache in her jaw and a strange tightness across her chest. She wasn't in pain exactly, but she couldn't shake the feeling that something was wrong. Her breathing felt labored even though she was standing still. At first she chalked it up to anxiety, but then she remembered something her doctor had once told her. If you feel something strange and it doesn't make sense, don't wait. Call for help. So she did. That decision likely saved her life. This is the biggest lesson. The body whispers before it screams, and when it comes to your heart, those whispers are your chance to act before irreversible damage occurs. Too often, people wait for the stereotypical chest-clutching moment, thinking, it can't be serious. It's not that bad, or I'll wait and see. But heart attacks don't follow a script. They can come on quietly and still be deadly. So if you ever notice a strange pressure in your chest, if your breathing becomes shallow for no reason, if you feel weak, sweaty, dizzy, or nauseated without explanation, stop what you're doing, sit down, take note of your symptoms, and most importantly, don't ignore them. When in doubt, treat it like a heart attack, call for help. The worst that happens is you were cautious. But the best case scenario, you just saved your own life. If you are finding these tips quite valuable, please leave a comment. And if you haven't subscribed yet, do subscribe and hit the notification bell so you don't miss any new videos. If you suspect you're having a heart attack, the very next step, without hesitation, is to call emergency services. This is not the time to wait it out, see if it gets better, or try to be tough. Those instincts, though well-meaning, can cost you your life. Time is everything when your heart is in crisis. Every minute your heart muscle is starved of oxygen, damage is being done, damage that could become permanent. Delaying treatment doesn't just increase the risk of complications, it increases the risk of death. The faster you call for help, the faster trained professionals can intervene with life-saving treatment, medication, and support. Calling 911, or your country's emergency number, is not just about transportation to the hospital. It brings emergency medical responders to your doorstep. People equipped with defibrillators, oxygen, clot-busting drugs, and the ability to keep your heart beating if it stops. These are the tools you won't have at home and can't get from a car ride. And please, do not drive yourself. People have collapsed behind the wheel while trying to make it to the hospital. Not only does that endanger your life, it puts others at risk too. Driving while having a heart attack is like walking a tightrope with your eyes closed. You are too vulnerable to go it alone. Take the story of Marvin, 75. One evening he felt a crushing pressure in his chest, followed by a wave of dizziness and nausea. He grabbed his phone and almost called his daughter, thinking she could take him to the ER. But something told him to call emergency services first. He did, and that choice may have saved his life. The paramedics arrived quickly, administered oxygen, and gave him aspirin and medication before they even reached the hospital. As one of them later told him, if you had waited even 10 more minutes, this might have ended very differently. It's also important to remember this. You don't have to be certain that you're having a heart attack to call. Paramedics would rather arrive to find out it was something else than show up too late to help. You will never be punished for being cautious. In fact, your caution may be the very thing that keeps you alive. If you live alone, preparation is key. Make sure your phone is always nearby, especially when you sleep, bathe, or rest. Learn how to activate the emergency call feature on your phone. Many smartphones allow you to dial emergency services even when locked or with a quick button sequence. Take a few minutes today to learn how it works. That knowledge might be the most important thing you ever learn. When your heart is in trouble, every second matters. Don't gamble with time. Don't second-guess yourself. Don't try to be your own hero. Pick up the phone, make the call. Your life could depend on it. Once you've called for emergency help, there's a small but incredibly powerful step you can take while you wait, and it could make all the difference. Chew a regular strength aspirin. Yes, a single aspirin, not swallowed whole, but chewed. Why is this so important? Because most heart attacks are caused by a blockage in the arteries, usually from a blood clot that prevents oxygen-rich blood from reaching part of the heart muscle. Aspirin is a blood thinner. It doesn't dissolve the clot entirely, but it helps prevent it from getting worse and may slow the formation of new clots. This could reduce the severity of the heart attack and, in some cases, even stop it from becoming fatal. Now, why chew it instead of swallowing it whole? Because chewing breaks it down more quickly, allowing it to enter your bloodstream faster. Studies show that when aspirin is chewed, it can start thinning your blood in as little as 5 minutes. And in a heart attack, 5 minutes can mean the difference between recovery and catastrophe. Let's consider Harold, age 69. One evening, while watching the news, he noticed an odd pressure starting in his chest. It wasn't sharp, but it was tight, like something was wrapping around his ribs. His left arm felt weak. He remembered reading that aspirin could help during a heart attack. So he reached into his kitchen drawer, pulled out a bottle, and chewed one right then and there. Paramedics later told him that quick action helped reduce the damage to his heart. His cardiologist even said, "That pill likely bought you time we needed to save your life." Here are a few things to keep in mind. The ideal dose is a standard 325 milligram aspirin. If that's not available, 2 to 4 low-dose baby aspirins can work too, as long as they're uncoated. Chew. Don't swallow whole. Uncoated aspirin works best and fastest. Don't take aspirin if you've been told by a doctor that it's unsafe for you. For example, if you're allergic, have a bleeding disorder, or are on certain blood thinners. In those cases, skip this step and wait for help. Don't take enteric-coated or delayed-release aspirin if you can avoid it, but in an emergency, if that's all you have, chew it anyway. Most importantly, make sure aspirin is accessible. That means keep some in a nightstand drawer if you live alone. Store a few tablets in your wallet, purse, or even a pill container on your keychain. Check the expiration dates regularly. Tell close family members or caregivers where you keep your emergency stash so they can help if you can't reach it yourself. It might seem too simple to matter, just one small white tablet, but this is not a myth. Chewing an aspirin during the onset of a heart attack is a widely recommended emergency step backed by medical professionals and emergency responders around the world. That small pill could be the most powerful tool you have in those first critical minutes. It's not just a precaution, it's a proven lifesaver. If you're finding these tips quite valuable, please leave a comment, and if you haven't subscribed yet, do subscribe and hit the notification bell so you don't miss any new videos. After you've called emergency services and taken an aspirin, if it's safe for you, the next step is simple in action but absolutely critical in importance. Stop everything and rest. This might sound counterintuitive. In moments of panic, our instincts often tell us to do something, gather medications, unlock the door, find someone to call. But during a suspected heart attack, movement can make things worse. Your heart is already under stress, struggling to pump blood where it's needed. Every extra effort, no matter how small, forces it to work harder at a time when it needs to work less. Even everyday motions like bending over to pick something up, walking across the room, or trying to get dressed can strain the heart and push your body toward a more dangerous tipping point. That's why your best course of action is to sit or lie down immediately and remain as still and calm as possible. The ideal position is sitting upright with your back supported, your feet flat on the floor, and your arms relaxed at your sides or resting on your thighs. This posture helps keep your airway open, reduces pressure on your heart, and encourages steady breathing. If you feel faint or dizzy, gently lie down on your left side with your head slightly elevated using a pillow or folded towel. This position can help maintain blood flow and prevent injury in case you lose consciousness. Let's look at a real-life example. Gloria, age 82, was tidying up her living room one afternoon when she started to feel a dull ache spread across her chest. Her first thought, "I should clean this up before I sit down," but then she remembered something her cardiologist had told her years ago. If you feel something odd in your chest, sit down and stay there. Nothing else matters. She paused, eased into her favorite recliner, and focused on slow, steady breathing while she waited for help. Paramedics later told her that remaining still likely prevented her symptoms from escalating into full cardiac arrest. And that's the truth. Doing nothing is doing something. It gives your heart a chance to stabilize. It conserves oxygen. It reduces the chances of your heart slipping into a dangerous rhythm. In fact, sitting quietly might be the most powerful thing you can do in those precious minutes before help arrives. You might feel silly, scared, or even guilty about just sitting there, but this isn't laziness or helplessness. It's a deliberate act of self-preservation. It's choosing stillness to survive. If you're in a chair without arms, try not to slump. Keep your posture supported, so you're not putting pressure on your chest or restricting your breathing. If you're lying down, don't curl into a ball. Stretch your body out gently and breathe deeply. And if you feel like panicking, which is completely normal, remind yourself that the best thing you can do right now is conserve your energy and let the professionals take over when they arrive. Your job is simply to keep your heart from working any harder than it already is. Stay put, stay calm, let your body rest. This isn't giving up, it's giving your heart the fighting chance it needs to make it through. In the middle of a medical emergency, the last thing on your mind might be your front door, but that small detail can make a big difference. If you've already called for help and you're still steady enough to move, the next practical and potentially life-saving action is this. Unlock your front door. This small effort, when done safely, can shave off precious seconds, sometimes minutes, that emergency responders need to reach you and begin treatment. Time is everything during a heart attack. If paramedics arrive and find the door locked, they'll have to spend time figuring out how to get in, forcing entry, locating building staff, or waiting for someone else to arrive with a key. Those delays can mean lost time that your heart simply doesn't have. If you're near the door and your body still feels stable, go ahead and unlock it. Open it if you feel safe doing so, or at least unbolt and unlatch all locks so emergency responders can walk in without resistance. However, if you're feeling dizzy, lightheaded, or like you might pass out, don't attempt it. The risk of falling and injuring yourself can be just as dangerous. In that case, stay put and focus on slowing your breathing and conserving energy. Paramedics are trained to force entry if needed, and your safety comes first. Think about Dennis, age 77. One morning while pouring his coffee, he felt a tightening in his chest and a wave of nausea. He knew something wasn't right. He called emergency services, took an aspirin, and, because he still felt steady, he walked calmly to the front door and unlocked it. Then he sat down near the entrance and waited. When the paramedics arrived minutes later, they were able to walk right in and begin treatment immediately. One of them later told him, "That open door probably saved us at least 30 seconds. That doesn't sound like much, but it can mean everything during a heart attack." Preparation makes this step easier. Here are a few things to consider before an emergency ever happens. Keep your keys in a consistent, visible location near the entrance, especially if others may come to help. Install a smart lock that can be opened with a phone or code, especially useful if a loved one needs to get in quickly. Use a coded lockbox outside your door with a spare key. Give the code to someone you trust, such as a neighbor, friend, or adult child. If you live in an apartment or gated community, make sure emergency responders can access your building. Keep your unit number clearly displayed, and if your building uses a call box, make sure emergency services can be buzzed in easily. These simple measures may seem small now, but in an emergency they are powerful acts of foresight. They can reduce chaos, protect your safety, and give responders faster access to do what they do best, help save your life. So remember, only unlock the door if you can do so safely. If not, stay seated, stay calm, and know that help is still on the way. But if you're steady enough to act, that unlocked door might be the bridge between distress and recovery. If you are finding these tips quite valuable, please leave a comment, and if you haven't subscribed yet, do subscribe and hit the notification bell so you don't miss any new videos. In the middle of a heart emergency, especially when you're alone, your phone becomes more than a tool. It becomes your lifeline. It connects you to trained professionals, keeps your loved ones informed, and in some cases may even speak for you when you can't. That's why it's essential to use two features on your phone wisely, the speaker function and the medical ID. Use the speakerphone function. After calling emergency services, put your phone on speaker mode. This small adjustment can make a big difference. It allows you to keep your hands free in case you feel weak or shaky. Rest comfortably without having to grip the phone. Focus on breathing slowly and staying calm. Continue receiving instructions from the dispatcher, even if you lie back or move. Most importantly, it lets the dispatcher hear your environment. If you suddenly become unable to speak or lose consciousness, they might still detect labored breathing, background noise, or silence that tells them your condition has changed, and that may alter how quickly and how urgently they respond. You don't have to be tech-savvy to use this feature. On most phones, the speaker button appears as soon as the call connects. Tap it once and your hand's free. If you've never used it before, take a minute to practice today. In an emergency, that familiarity can bring comfort and clarity. Set up and use the medical ID feature. Next, take advantage of your phone's medical ID or emergency information feature. This is a built-in option on most smartphones that allows first responders to access vital health details from your lock screen without needing your password or fingerprint. Your medical ID can include your full name and date of birth, any medical conditions like diabetes, high blood pressure, or heart disease, allergies, especially to medications like penicillin, a list of medications you take, the presence of implants or devices like pacemakers, your blood type, if known, names and phone numbers of emergency contacts. Imagine you've collapsed just moments before help arrives. You can't speak, you're unresponsive. But because you've filled out your medical ID, paramedics can still make informed decisions about what to give you, what to avoid, and who to notify. Consider the story of Carla, 80. She began experiencing symptoms while sitting in her favorite chair. She had just enough time to call 911 and describe how she felt. Moments later, she lost consciousness. When the responders arrived, they found her phone on the floor next to her. One paramedic tapped the emergency button on her lock screen and accessed her medical ID. Instantly, they knew she had a pacemaker, that she was allergic to sulfur drugs, and that her daughter was listed as her emergency contact. Because of that, they were able to avoid complications and alert her family right away. How to set it up takes less than 5 minutes. For iPhone users, open the Health app. Tap your profile picture in the top right. Select Medical ID, then tap Edit. Fill in your details and toggle Show when locked to on. For Android users, open the Settings app. Search for emergency information or medical info. Enter your health data and emergency contacts. Make sure it's accessible from the lock screen. This varies slightly by device. If you're unsure how to do this, ask a friend, family member, or caregiver to help. This is a one-time setup that could save your life for years to come. In a true emergency, you may only have a few precious moments of clarity and strength. Use them well, call for help, turn on speakerphone so you can conserve energy. And let your phone carry vital information if your voice no longer can. Technology can't stop a heart attack, but it can be the bridge between crisis and care. Of all the steps you can take during a heart attack, this one might seem the least important, but don't be fooled by its simplicity. In fact, it may be one of the most powerful tools you have in the moment. Your breath. When a heart attack begins, your body doesn't just react physically, it reacts emotionally. Fear, panic, and anxiety can rush in like a tidal wave. Your chest feels tight, your thoughts race, and every second seems louder and more urgent than the last. And with each passing moment, your heart may begin to beat faster, not just from the attack, but from the fear itself. But here's the truth. You can use your breath to take back some control. Calm, focused breathing helps regulate your nervous system. It signals your brain and body that you're trying to stay calm, which can prevent your heart rate from accelerating further. It may also help reduce oxygen demand and prevent dangerous heart rhythms that can be triggered by stress. No special training, no equipment, just you and your breath. Try this simple technique. It's called 4-6 breathing, and it's designed to bring your nervous system out of panic and into stability. Inhale slowly through your nose for 4 seconds. Imagine pulling in calm, clean air. Feel your belly, not just your chest, rise as you breathe in. Hold that breath for just a moment. Let it settle. Exhale gently through your mouth for 6 seconds. Imagine letting the tension flow out with the air, like you're blowing out a candle without making it flicker. Repeat. Do this for a few cycles or until your breath starts to feel more natural and less forced. You don't have to be perfect. If you can't hold for exactly 4 or exhale for exactly 6, just do your best. The point is slowness, not precision. Let's look at someone who used this technique in real life. George, 84, had just sat down after working in his garden when a strange, crushing sensation began building in his chest. His hands trembled, his breath became shallow. He was alone and terrified. But then he remembered a calming exercise his granddaughter had taught him months earlier. He closed his eyes, placed one hand on his chest, and began to focus on his breathing. In for 4, out for 6, over and over. He later said, I kept repeating in my head, stay calm, stay alive. That breathing didn't stop the heart attack, but it helped him stay conscious. It helped his body remain as stable as possible, and it gave the paramedics a few more precious minutes to arrive and take over. Why it matters. Breathing won't unblock an artery or stop the chest pain, but what it can do is prevent your heart from entering an even more dangerous rhythm, reduce panic, which lowers adrenaline levels, help keep your oxygen levels more stable, make the wait for help feel less overwhelming. In fact, controlled breathing is taught to patients with heart disease, anxiety, PTSD, and more, for exactly these reasons. It's the body's natural way of resisting the chaos of fear. So remember this, in the middle of a heart attack, your body is fighting for you. Your job is to help it, not make it work harder. Breathe slowly. Let the fear pass like a wave. Focus on just one thing at a time, your breath, and repeat this mantra if it helps. Calm mind, steady heart. Because sometimes those quiet breaths are the only thing keeping you grounded long enough for help to reach you. And that's all you need to survive. Surviving a heart attack when you're alone can feel like an impossible challenge, but it's not. It's not about being lucky or having superhuman strength. It's about being aware, prepared, and calm when it matters most. You don't need to be a doctor. You don't need fancy tools. You don't even need someone else in the room. What you do need is a plan. And now you have one. Let's take a moment to look back at the steps you've just learned. Recognize the early signs: chest pressure, shortness of breath, unusual fatigue, or radiating pain. Listen to your body's whispers before they become screams. Call emergency services immediately. Don't wait, don't drive yourself, don't guess. Get trained, help on the way as fast as possible. Chew an aspirin if you're not allergic and it's safe for you. That small pill can help prevent further damage while you wait. Sit or lie down and stay still. Give your heart the best chance to stabilize. Movement is the enemy. Rest is your ally. Unlock your door if you can do so safely. Make it easy for help to reach you. A few seconds saved can make all the difference. Use your phone's speaker and medical ID. Let technology work for you. Make it easier for others to help, especially if you can't speak for yourself. Breathe slowly to calm your body. Fear is real, but you can push back with steady, focused breaths that bring clarity and calm. Each one of these steps buys you time. Each one gives your heart a fighting chance, and each one is a reminder that even when you're physically alone, you are not powerless. This isn't just information, it's peace of mind. A heart attack is one of life's most terrifying medical emergencies, especially when you're by yourself. But now, instead of uncertainty, you have knowledge. Instead of panic, you have a plan. Ask yourself, which of these steps stood out the most to you? Is there something you hadn't considered before, like unlocking the door or using speakerphone? Are there changes you can make today to prepare, like storing aspirin nearby or filling out your medical ID? Preparation is not fear, it's confidence. It's strength. It's love. For yourself, for your family, and for the life you're protecting. So take a few moments now, reflect, maybe even print out these steps and post them somewhere visible. Talk to your loved ones, help them be ready too. Because what you've just learned doesn't just apply to you, it could save someone else you care about. You're not alone in this. If this guide helped you, please consider sharing it with a friend, neighbor, or family member. Leave a comment below and tell us what's one thing you're going to do today to be more prepared. Your voice may be the one that inspires someone else to get ready and stay alive. Thank you for being here. Thank you for caring, and thank you for taking control of your health, even in the quiet moments when no one else is watching. You are not helpless. You are ready, and that might make all the difference.